This presentation is about Gcse cardiovascular disease. So the key questions are: what is cardiovascular disease? How does smoking and obesity affect the risk of cardiovascular disease? What are the reasons for a range of treatments? So what is cardiovascular disease? Cardiovascular disease, or CVD, is a broad term which includes all the diseases of the heart and circulation, which include coronary heart disease, angina, a form of chest pain, heart attacks, congenital heart disease, which are heart disease that you get from birth, and strokes, which are blood clots in the brain. It's also known as heart and circulatory disease. So what is obesity? And how do you know if you're obese? What are some of the things that obesity can lead to? Well, when we have a diet that's high in sugars and fats, this can lead to obesity, where large amounts of fats are formed under your skin and around your organs such as your heart and your kidneys. A lot of this fat buildup is around your belly, so we call this abdominal fat. We need some fat to cushion organs when we move, to store some vitamins and to provide us with a store of energy, but too much fat can increase the risk of many diseases, including cardiovascular disease. Cardiovascular disease is a result of the circulatory system functioning very poorly. One sign of this might be high blood pressure. Because of this high blood pressure, this could lead to heart pain, and eventually, if untreated, it could lead to heart attacks. One of the ways of measuring obesity is by using a calculation called the body mass index. The equation on the screen tells you how to calculate it. It's our mass divided by our height squared. The table shows the categories of your BMI values. According to medical professionals, below 20 is underweight, 20 to 25 is normal, and 25 to 30 is considered overweight. Anything above the figure of 30 is considered obese. So let's do an example calculation. A man has a body mass of 101 kilograms and his height is 1.88 meters. So what is his BMI? Well, let's use the equation from before. After we've calculated his BMI, it should work out at 28.90, which would be classed as overweight. It's not quite 30 yet, so he's not classed as being obese. Now, the advice we normally would give to someone who is overweight would be to eat less fat and less sugar in their diet, and also to exercise more in order to burn more calories. However, there is a problem with BMI calculations. These measurements actually belong to this rugby player, who I'm sure already has a very good diet and is obviously very active. What the BMI doesn't take into account is muscle mass. If you have a high amount of muscle, you're going to weigh more. Your body mass will be more because muscle weighs more than fat. So therefore, there is a limitation to the use of BMI to calculate for people with higher than normal muscle mass. The fat that seems to be most closely linked with cardiovascular disease is abdominal fat. Dividing your waist measurement by a hip measurement is something that we can calculate to get a waist to hip ratio. This gives us a better method of measuring abdominal fat than BMI does. So to summarise, obesity can lead to an increased risk of cardiovascular disease. Cardiovascular disease could eventually lead to a heart attack or a stroke, which is a blood clot in the brain. So how does smoking affect the risk of cardiovascular disease? Normally, substances damage the lungs from smoking, but some substances can cross over to the blood and damage the blood vessels because the particles are so small. Your blood pressure will increase and your arteries will become more narrow as there is a buildup of fat, which we call a plaque. This leads to an increased chance of heart attack and stroke. The treatments of cardiovascular disease will include exercising more, giving up smoking, or taking medicines to reduce blood pressure in extreme cases. If our blood vessels are too narrow, especially the coronary arteries, then not enough oxygen and nutrients will reach the cells of the heart, and this could cause a heart attack. The treatments include widening the blood vessel by using a stent. A stent is a device, like a metal cage, which is inserted into the artery. A balloon is inflated within the artery to push out on the stent, and then the stent becomes a scaffolding. The stent widens the artery and allows more blood to flow, and this decreases the blood pressure. Another option is heart bypass surgery, when an artery from one part of the body is then inserted to the artery where there is damage. This allows blood to flow around the site of damage or blockage. Patients who have these procedures often take medicine or blood thinners throughout their lives to help prevent a heart attack or a stroke. Aspirin is an example of a blood thinner.